Good evening, Dr. Gordon. This video is for assignment number 7, module number 7, and it speaks to compliance, accreditation, patient safety goals, and cost savings. The presentation will examine the main compliance policies and agencies that set standards for the healthcare facilities in the United States. It's important that these facilities have the opportunity to meet standards from different organizations that are set by these agencies and also benchmark themselves against their compliance requirement. The process is in quest of continuous quality improvement. So by making sure that you meet compliance standards, you're always looking at ways that you could become more compliant. The second portion of the presentation will focus on several areas of patient safety as set out by the patient safety goals of 2018. And finally, I will speak about the opportunity to save money by meeting some of these compliance and safety goals. After reviewing the agencies, and I spent a lot of time reviewing the different agencies, the ones that I picked out that are setting standards for our healthcare organizations include CMS, Medicare and Medicaid, HIPAA, which is for information, Health and Human Services, JCO, and ONC, which was new to me, but that's the Office of Electronic Information, which has become much more important as all of the EMR systems are implemented within hospitals. There are a number of areas of different facilities that have accreditation organizations and compliance organizations, such as utilization review, long-term care facilities, SNF facilities. All of those also have compliance agencies, but these are the ones that are most important for the big hospitals. The first thing is very basic. The compliance policy is to have an evaluation of compliance risk areas in your hospital at all times, a thorough assessment on a regular basis of those areas that are regulated to determine whether or not you meet the criteria and if you need updating. So that's number one. Number two is hiring practices, which I also thought was interesting. Hiring practice and developing hiring practices that are exactly the same across the board. And what that helps you do is avoid negligent hiring practices. So you don't get yourself into a situation where you have risky employment practices. You must have the licenses, you must have certifications, you need to make sure people are up to date, that they have their CEUs, that they've been vaccinated if you require that, they've had flu shots if you require it, or they're wearing a mask if you require it. All of those things are necessary to have in place, because if you don't have them in place and people get away with some of these things, then you begin to see, or could see, bad behavior by some of your employees, which is something that you don't want to do because it's breaking protocol. Healthcare insurance and billing compliance. This is regulated by CMS, mandatory to identify all of your customers and assure that compliance is maintained across every single area of the hospital. Anybody who interacts with a patient that could potentially bill for time or procedure or treatment must be well educated about this compliance policy and exactly how they're going to do it, regardless of how many people actually touch the pre-billing kind of encounters with your patients. Because if you bill too little or too much, you can get into loss of dollars, or you can get into situations where you're accused of fraud. Medical records and informed consents, and this is specifically medical record releases. By law, a patient's records are defined as records related to their health history, to their diagnosis or condition, or relating to treatment provided or proposed treatment to be provided. Physicians are required to provide patients with copies of their medical records within 15 days of receipt of the request. This has to be a written request. But the interesting thing is now doctors' offices sort of routinely charge for this service. And I called around to a couple of places, and we range in between $15 and $40 was the last, the largest that I found. The idea of informed consent, which is sort of correlated with this medical records release. Informed consent is the actual request to get your medical records, but there's also informed consent that you actually ask the patient to agree to if you're going to be doing a treatment for them. And what this has to include, your informed consent has to include the nature of the decision or procedure that you're asking them to either make or agree to, responsible alternatives and reasonable alternatives to the proposed intervention. I'd like for you to have the surgery. If you don't, we could do X, Y, and Z in hopes that they would alleviate some of your issues. The relevant risks, benefits, and uncertainties, both of the procedures and the treatments that are proposed, and the reasonable alternatives. You have to give them the risks and benefits of all of that. You have to do an assessment of whether or not the patient understands you. And that's very interesting because I don't think anybody's ever asked me if I understand. They've asked me if I have any questions, but never if I understand. And I don't think we really assess that very well. And then the acceptance of the intervention by the patient. Those are all required within an informed consent. The next one, which I thought was interesting, and I pulled it out because professional discounts and professional courtesy, waiving copays, giving no charges, that sort of thing. It is still legal to not charge a patient or your crony or buddy if they come into the office. It is not legal to give a discount on the procedure or treatment itself. Many times you got into a situation where the patient paid the copay and then you gave a discount on the procedure, and what happened there is that you actually give the discount to the insurance company, and I think nobody was really into giving discounts to the insurance company. There was also an issue of kickbacks and inducements to patients for patient referrals. I know that this occurred in a small town I lived in and practiced in with cosmetic surgery, and that is now illegal as well. Medical necessity and documentation. And this is right hand in hand with coding and medical billing and coding. So I mentioned that. So if you code something correctly, and it gets denied for any reason, you can actually appeal on the basis of medical necessity. And the way you document that is the following. Number one is you have to really determine the severity of the symptoms and the signs of the direct diagnosis that is exhibited by your patient, as is different from the typical signs and symptoms of that particular diagnosis. So if you have somebody who has outrageous pain that is not controlled by anything as opposed to somebody who has pain, that's something that you can document and see if you can get an appeal to go through. This is the diagnosis driver. Multiple diagnoses may be involved. You have to include all of them and really review the signs and symptoms and the severity of each. The second thing you have to include is a probability of an adverse outcome for the patient if they don't have the treatment. You also have to indicate the risk to that patient if they don't have the treatment, and the risk to the patients if they do have the treatment. So you do both the risks and benefits of having this the particular service, and the risks and benefits of not having the service. And then the need and availability of diagnostic studies in your particular hospital. If you have asked that somebody be sent elsewhere and they are denied that, and they say, oh, use the CAT scan as opposed to a new, very fancy PET scan machine, you can appeal on that basis. Business and medical records retention was something that I looked at, and there are compliance policies that you must follow about this. One thing I thought was interesting, we know that business records in personal cases have to be maintained for 7 years. In medical cases have to be maintained for 10 years. But the interesting thing is a minor, the hospital must retain medical records for 10 years, or in the case of a minor patient, records must be retained until the patient turns 20 or 10 years, whichever is longer. So it could be much longer. Confidentiality of medical information. We have laws all over the place. I am sure that everybody remembers a time where they had to sign a HIPAA form every single time they walked into a doctor's office. Still on occasion, I do have to sign one. The HIPAA really protects individually identifiable health information. And this is information about all of the things that I mentioned earlier: treatments, proposed treatment, past medical history, but it also includes demographics, ways that you might be able to find out who the patient was. You have to include always the individual's past, present, or future physical or mental health or condition. You have to have a provision of health care to the individual that has to be protected, and the past, present, or future payment for the provision of health care to be given to the individual. The next compliance issue that I discussed or will discuss is patient bill of rights, and actually we delved into that in such depth, but each person, each employee must know exactly what the bill of rights are. Every patient must get one when they go into a hospital, and they must be followed. Employee safety rights and obligations. OSHA takes care of this. And every employee has a right to practice in a safe environment and to know what to do should they get into trouble with anything that they're using or testing or any kind of fluids that they come in contact with. And typically there are hospital sanitarians or hospital environmental specialists that make sure that MSDS forms are provided for any kind of product that you're using that you may not know how to dispose of or how to take care of yourself if you're exposed to it. Finally, one of the things I wanted to say, and I think I did mention, that there are all sorts of other accreditation and compliance agencies that are specific to the type of facility that you're running. The next thing I want to talk about is the patient safety goals for 2018, and I think they're pretty straightforward. They've been coming out every year, and a lot of them are similar from year to year, but the 6 goals that are of import in 2018 are the identifying patients correctly, making sure that every single time you approach the patient, you ask them their name and their birth date. And patients find it very irritating. And, sometimes you don't even have to ask. They go, yeah, my name is so-and-so and my birth date is this. But there have been so many errors in a hospital just from, thinking you're talking to one person, you're really not. You're talking to the other one. Identifying patients correctly is number 1. Number 2 is improving effective communication, making sure that you are speaking to a patient on the level that they can understand, that you take the time to explain, and explain again if somebody doesn't understand you. And certainly with the diversity of hospital patients now and big cities now, you need to have a system set up that you can get almost any language translated for you, either via phone or via a personal ear-to-ear person. The important thing is that only in the very last possible circumstance do you use somebody who is a family or friend, because they interpret, but they put their own spin on it. And that sometimes can really lead a clinician astray. Number 3 is to improve the safety of high alert medication. I know the one that I think of immediately is either heparin, where there are different strengths of heparin and people end up getting the wrong strength, or even more importantly, and this has really been fixed of late, but when I started practicing, we mixed our own KCL bags. And now that I look back on it, it gives me nightmares. So high alert medications we have to be very careful of. Ensure the correct site, the correct surgery, the correct procedure, the correct person for any surgery. Now, people actually write on the limb that is going to be operated on. I've had knee replacement. They actually wrote, this is the knee. They put a big circle. I actually had to initial that I agreed that this was the knee that we were doing on that particular day. Too many cases of wrong limb, wrong surgery, etc. End up with rules like this. And they're good rules, for sure. Reducing the risk of healthcare-associated infections, and there is a myriad of these infections. The ones that we think of are central line infections, catheter infections, poor wound care infections, and there are places that just don't do the right kind of wound care. For those of us who have certification in wound care, it's really important that you use the right kind of treatment plan for wounds, because you can exacerbate a wound if you don't. And then reduce the risk of patient harm resulting from falls. I think that one of the things that I learned with falls prevention is that you really can't prevent a fall. You can attempt to prevent a fall, but the thing you want to do is prevent injury from a fall. And that's really important. So The use of a identification of a fall risk patient is almost useless. This was discussed in this past week in our discussion boards. What you need is what you're going to do if you identify the patient as a fall risk. Everybody knows that you tell them to use their call bell. You put a leaf on the outside of their door. You put a bracelet on them. But if you identify a really big fall risk, why would you not want to then do something and indicate what you're going to do for them? So since we have a really big fall risk, let's put them in a low bed. Let's put a fall mat beside them. Let's make sure that if we give them Lasix, for instance, we have a commode immediately by the bed, because that's a case where you give a medicine. It's not 15 minutes from now, I need to go to the bathroom. It's right this very second. I need to go to the bathroom. And the statistics say that most patient falls occur within 18 inches of the bed, which is very interesting. So those are some of the safety goals. I think that we have reduced so many of these incidences by such a great amount. It really works to have the goals and to have this be part of a hospital's accreditation and compliance system. And finally, to talk about saving money and cost control secondary to having compliance issues followed precisely. I think from having employees that are hired in an appropriate manner and are credentialed in the right way and checking through their credentials, all the way through insisting that your medical coding is done correctly, saves the hospital a tremendous amount of money in miscoding, having to wait for payment, miscoding, and having it overcharged and have fraud fraud charges considered. The other thing is, if you hire your patients correctly, if you have a very sophisticated compliance program and you make your employees really aware of this, you are really reducing your risk of whistleblowing or having disgruntled patients come back at you. You always want to make sure that the process that you use to terminate an employee is the same one that you use for every single person, that it follows your guidelines, because having a work termination suit brought against you is extremely expensive and not something that you want your hospital to build a reputation about. So all of these things are really important, and each and every one will help save money. This is the end of my presentation. Thanks very much.